Hi, I'm Suryo Gardner. I have a master's in clinical psychology, and I'm a certified BodyTalk practitioner and instructor. This bacteria is something where they have, again, boundary issues, and also from what my experience is they're fear-based. They have a lot of fear in their system. And so from my perspective, I'm going to have to deal with that fear initially. That's an important piece. And also they're going to look at diet. They're going to look at also their sexual partners, like are they in good relationship with their sexual partner, or is it somebody that they have a lot of conflict with? I would deal with relationship conflict probably first because that's the most obvious. You start at the top and then work your way down. And to have them look at, is this person somebody that they really are in a trusting, open relationship with? Do they have good communication? Do they have a good sexual life? Or is it filled with a lot of fear and shame and guilt? And shame and guilt come into play as well. And then I would go into the psychological aspect of their own fear, their own shame, their own guilt, and how that is incorporated in this situation. And we do a lot of emotional release work, so we're taking the charge off. And then you have to dig deeper into belief systems, because anyone coming up with this will typically have a lot of self-loathing belief systems. And so when you clear those, the person can feel more empowered, they can feel happy about themselves, and then they can have a new way of relating in their relationship, their sexual relationship. A bacterial infection can clear very quickly. The infection can clear up very quickly with BodyTalk because we have techniques specifically that are non-invasive to clear the system, to rebalance it actually. The psychological work can take a little bit longer because that has to go deep into the body. Again, it can go into the fascia, it goes into the cellular memory, it goes into the brain, it goes through generations. So it can clear, but I would say it would take several sessions to do that. But it's absolutely workable. I would suggest getting a BodyTalk session as soon as they can to deal with the infection, and then to start looking at their life, like what is their relationship, and so writing about that, beginning to open communication with their partner, and coming in, of course, for sessions, for BodyTalk sessions.